Good morning, everyone. Michelle here, and we have a special guest in the studio today. Why don't you go ahead and introduce yourself?
Hello, my name is Melissa Vutzla, and I'm a primary care physician with San Luis Valley Health.
Oh, wow. So you obviously see a lot of people then.
I do. I see primary care patients. I see patients of all ages, and I also have a special emphasis in skin.
Oh, so with
care.
the summer coming up, then that's probably a big issue for you then.
Absolutely.
What are your main issues when summer comes up, and what are some of the things you tell your patients to help them protect themselves from sunburns or anything of that nature?
So it's a good idea to stay out of the sun in the midday between 10 and 4. And if you're going to be outside in the sun, then you need to make sure you have sunscreen on. At least SPF 30 is recommended. If you will wear a wide brim hat, sunglasses, sun protective clothing, then that's a great idea to protect yourself.
So if you're somebody that gets a lot of sunburns, what is the potential harm in that?
So long-term sun damage, sunburns, severe sunburns, especially blistering sunburns, over time can cause damage to the skin. And over time, you can develop precancerous skin lesions as well as skin cancer, and that's what we try to prevent. Not only that, but the sun does age our skin.
Right. So you look 10 years older than you really are.
If you have a lot of exposure and repeated exposure, especially those who use tanning beds.
I was just going to ask, what happens with the tanning beds, and probably those spray-on tans are probably the safest.
Spray tans would be safer, much safer than tanning beds. Tanning bed is a lot more potent than the sun itself.
Oh, and so they're worse.
Absolutely is worse. And even one session can significantly increase your risk of skin cancer.
Wow.
I would encourage all people not to use tanning beds.
What is the worst thing that can happen to you from repeated sunburns, and what does that look like? And then what kind of care does somebody have to go through with that sort of thing?
Sure. So we often hear about malignant melanoma, and that is a type of skin cancer that you can develop from sun exposure over the years or from more intense sun exposure. It can also be genetic if you have a strong family history. Melanoma does kill many people every year. It can spread to lymph nodes and to other organs. So that is one thing to keep in mind. There are a few other more rare types of skin cancer that actually are more aggressive than melanoma, but we don't see those very often.
Okay, but they do exist.
They do exist. And patients that have melanoma, depending upon the stage, will definitely need further surgical excision of that area. They may need evaluation of their lymph nodes and sometimes systemic therapy.
Yeah. So what's great about our generation is we have all these preventative measures in place. We have sunscreen. I'm just reminded of my grandfather who used to run tractor back in the 30s and 40s. Maybe sunscreen hadn't quite been adapted yet, or
he didn't
even
have sunscreen.
Yeah, invented. So he did have a lot of melanoma on his ears, and he had chunks of his ears missing by the time he passed away. So I think it's great, and people should definitely take your advice in wearing sunscreen at all times, and hats and sunglasses and protective clothing. I know a lot of us go out in the summer sun just super excited to be in the summer, but we should always be aware of that.
Absolutely. Pale is the new tan.
Yeah, there you go. Is there anything else you'd like our listeners to know about skin?
Sure. So a lot of people feel that a base tan is healthy or will help protect them, but any tan is your body's response to damage from the sun. So avoiding getting a tan altogether is the best thing that you can do by protecting yourself with clothing, hats, sunglasses, and sunscreen.
So if you see somebody with a tan, it's actually damage from the sun, and they're wearing it very proudly, which is odd, if you really think about it.
And it's their body trying to repair itself.
Wow. And people are just gung-ho about doing that to themselves.
Absolutely. Yeah. It's our society that feels that tan is healthy.
Yeah. That's interesting. All right. Well, thank you so much for being on the air with us today. I really appreciate it.
You're welcome.
And I hope you have fun at the pool party.
I intend to.
All right. Thank you.
Thank you.